How's it going? I'm going to start off by showing you some shoulder joint glenohumeral movements, abduction and adduction, using some lateral dumbbell side raises. We're going to start off by doing some abduction movement, which is when I take these dumbbells and move them up like this, and the adduction is when I come back down with the dumbbells. So this is the abduction and this is the adduction. And in this movement, they are moving along the frontal coronal plane and on the sagittal axis. Next, I'm going to show you some shoulder girdle movements, protraction and retraction, doing some dumbbell flies on this bench right here. To start off, we'll show some protraction when I bring the dumbbells up like so. That is protraction. When I bring them back down like this, that is retraction. The protraction and the retraction. Protraction, retraction. Now the dumbbells are moving along a sagittal plane and on the frontal axis. Next, I'm going to show you some knee movements, some extensions and flexion using some leg extensions, the exercise. So, really simply here, to do this exercise, I start by extending my legs. So you see, this is the knee extension when my legs come up like this. And then the flexion is when my knees and legs go back down to the 90 position. So you see the extension and the flexion. They are moving along a sagittal plane on the frontal coronal axis. Next, we're going to show you some more things. Hey, how's it going? I'm going to show you guys some hip medial lateral rotation by doing a baseball swing. I'll show you what it looks like real close, a nice slow swing. As if I'm looking at the picture, something like that. You can see that my hip is moving, my leg is tilting outward like so, and when I come back to rest, it tilts back to normal position. When I do this, I'm moving along a transverse plane on an oblique axis. Now I'm going to attempt to hit a ball for you guys. So here we go. You'll see what it may look like. So that is the hip medial lateral rotation. How's it going? Another one here I'm going to show you is some lumbar spine lateral flexion using this racket. So basically what it will look like is something like this or this, where my loin, my lumbar, which is here, bends or flexes with the flexion along my frontal coronal plane and the sagittal axis. So now I'm going to attempt to hit a ball coming this way to demonstrate what it would look like in real. Now we're going to be talking about Tensegrity. Here is the model that I have made. You can already see with my model that one of the bands is a little weaker than the others. And that's okay for this demonstration. To relate this model to the body, the sticks in here would be like our bones, while the elastic bands are like the fascia in our body. And when one part of the structure moves, it affects other parts in the structure, and it all moves as one. If I had to pull, it expands. You can kind of see it expands everywhere. Like these two poles that I'm pulling expand, these two in the middle, as well as these two on the outside. And to explain more on what Tensegrity is, it's all about compression and tension of a structure. to more relate this to our body, for example, this weaker, longer elastic, say that would be an injured muscle. Injuries, muscles that would more be tight, but for this instance, to make it easy, we'll use it, say it's bigger. It changes the entire structure and how it would operate as a whole. So to show another example, if I was to tighten a fascia, let's go with over here, the model changes and the structure is more tense and it struggles moving, as well as if I leave it free, there's more movement in the structure. So when you have an injury, for example, and something does get loose or tightens up, it affects your performance in things you'll do in your everyday life. So for example, say I tore or I pulled a muscle, it changes the entire way my body performs, and the entire structure of it will perform differently based off one injury that you can result in. And that's basically a quick sum up on how tensegrity works in the body.